Probably one of the biggest misconceptions about hypertension or high blood pressure is that it always causes obvious signs and symptoms. But the vast majority of people with high blood pressure feel completely normal. That's exactly why hypertension is often called the silent killer. It can quietly damage the heart, the brain, the kidneys, the eyes, and the blood vessels for years, without you even noticing it at all. And in rare cases when symptoms and signs do occur, they are often vague and non-specific. For example, in rare cases, high blood pressure may cause a headache. But headache is not always caused by high blood pressure or hypertension. They can happen for many other reasons, like stress, dehydration, lack of sleep, caffeine withdrawal, sinus congestion, or even eye strains. Because of this, a headache is not always a reliable sign of hypertension. The only way to know for sure if you have high blood pressure or not is to measure it with a blood pressure monitor. Because by the time the obvious signs and symptoms of high blood pressure finally appear, serious damage may have already been done. And in this video, we will discuss what uncontrolled high blood pressure can do to your brain, your eyes, your heart, your kidneys, and your other organs. But before we start talking about high blood pressure and damage to specific organs, let's talk a little about how hypertension can actually cause damage in the body. Persistently elevated high blood pressure puts excessive stress on the walls of your blood vessels, causing both structural and functional damage over time. When we talk about pressure inside blood vessels, many people imagine them bursting like an overinflated balloon. And yes, it could happen rarely, but in most cases that's not what happens. In fact, serious complications of high blood pressure are usually not caused by blood vessels bursting. They are often caused by blood clots and gradual damage inside blood vessels. And you might wonder, if high blood pressure simply means more force pushing against the wall of blood vessels, what does it have to do with blood clots? The answer lies in the inner lining of your blood vessels. Your blood vessels are not like an ordinary garden hose. Their inner lining, called the endothelium, is a highly active layer of cells that constantly releases chemicals to keep blood flowing smoothly and prevent unwanted clots formation. And when blood pressure stays elevated for too long, it can injure this delicate lining. And once damage to the endothelium occurs, the endothelium can no longer perform its function properly. And instead of being antithrombotic, meaning to prevent clot formation, it can shift toward prothrombotic state, meaning it actually promotes formation of blood clots. And those clots can block blood vessels, cutting off blood flow downstream, and a lack of blood flow to the heart muscles causes a heart attack, and a lack of blood flow to the brain cells is the definition of a stroke. But the relationship between high blood pressure and health isn't simply a matter of safe and dangerous. It's actually a spectrum of risks. As blood pressure rises, the risk of serious health problems rises with it at the same time. In fact, research showed that excessive risk of illness and death associated with hypertension roughly doubles for every 6 millimeters of mercury increase in diastolic blood pressure, or the bottom number on blood pressure reading. In other words, even relatively small increases in blood pressure can translate into larger difference in long-term risks. But the damage caused by high blood pressure isn't the same for everyone. Two people can walk into a doctor's office with exactly the same blood pressure reading, yet have completely different outcomes. One person may eventually develop severe complications such as heart attack, strokes, heart failure, chronic kidney disease, vision loss, or dementia. Meanwhile, the other person may appear perfectly healthy, walking normally, feeling fine, and even joking with doctors until late in life. But why does this happen? Because human bodies don't all respond in exactly the same way. Our genes, our age, our lifestyle, our underlying medical conditions, and many other factors influences how much damage high blood pressure causes and how quickly that damage develops. And when damage do happen, it can affect many organs and systems. Let's start with the brain. High blood pressure is one of the biggest causes of a stroke. When it comes to stroke, hypertension is one of the most important risk factors we know, and it is estimated to contribute to nearly 60% of all strokes worldwide. One reason is that high blood pressure increases the likelihood of blood clots formation. Those clots may develop directly inside the arteries supplying the brain, or they may form elsewhere in the body, and then they travel through the bloodstream until they lodge in the brain artery and block it. Once that blockage occurs, blood can no longer reach part of the brain which was supplied by the blocked artery buffer. Without blood, there is no oxygen, and without oxygen, the brain cells start dying within minutes. This is what we call ischemic stroke, and it makes up about 80% of all strokes. Ischemic simply means part of the body is not getting enough blood supply. In addition to ischemic stroke, constantly elevated blood pressure also puts stress on the delicate arteries inside the brain. Over time, that pressure can weaken them, making them more likely to tear or rupture, leading to bleeding inside the brain. This is called a hemorrhagic stroke. Hemo refers to blood, and rhagic means bursting or excessive bleeding. So, hemorrhagic stroke literally means a stroke caused by bleeding. And this type of stroke represents about 20% of all strokes. And the good news is that lowering blood pressure, especially systolic blood pressure, can dramatically reduce the risk of both ischemic stroke and hemorrhagic stroke. And in the real world, that means fewer people losing the ability to speak, fewer people become paralyzed on one side or both sides of the body, fewer people struggle to swallow or understand language, fewer people needs lifelong care, and fewer families watching a loved one lose their independence and quality of life overnight. In addition to stroke, years of uncontrolled high blood pressure have also been linked to a higher risk of developing dementia, including vascular dementia and Alzheimer's disease. Vascular dementia is a type of dementia caused by reduced blood flow to the brain. Tiny strokes or long-term damage to the brain's small blood vessels gradually injures brain tissue, leading to problems with memory, thinking, judgment, decision-making, and many more. For example, a person might slowly start forgetting their recent conversations, struggle to manage simple tasks like paying bills or following a recipe, or become noticeably slower and more confused when making everyday decisions. In many people, the decline happens step by step as additional damage accumulates over time. That's why controlling blood pressure today can reduce the risk of developing cognitive impairment later in life. One of the best-known studies supporting this is the SprintMind trial, which found that intensive blood pressure control significantly reduced the risk of mild cognitive impairment and probably dementia compared with standard blood pressure control. Then there is the heart. Among all the organs affected by hypertension, the heart suffers some of the most serious consequences. Think about what your heart has to do. It has to pump blood against the pressure inside your arteries every second of every day. And when blood pressure stays high for years, the heart has to work much harder just to push blood forward. To cope with this extra workload from hypertension, the muscles of the heart gradually become thicker and thicker. And this condition is known as left ventricular hypertrophy, or LVH. You can think of it a bit like going to the gym. When you constantly lift heavy weights, your arm muscles become bigger and bigger because they are adapting to the increased workload. The same thing happens to the heart muscles with high blood pressure or hypertension, except that having a bigger biceps or triceps is usually a good thing, and a thicker heart muscles is usually a bad thing, and sometimes very bad thing. As the wall of the heart becomes thicker, the main pump chamber, the left ventricle, has less room inside it to fill with the blood. When it is not properly filled with the blood, it has not enough blood to pump forward. It cannot pump as much blood out to the rest of the body. The thickened muscle also becomes stiff, making it harder for the heart to relax between the beats to fill with blood, and that makes the situation even worse. And on top of that, the abnormal muscle structure can interfere with the heart's electrical system, increasing the risk of dangerous rhythm disturbances. That's why people with left ventricular hypertrophy have a substantially higher risk of heart failure, abnormal heart rhythm, reduced blood flow to the heart and the rest of the body, heart attack, and even sudden cardiac death. But the good news is that left ventricular hypertrophy is not always permanent. With proper treatment and good blood pressure control, especially effective lowering of systolic blood pressure or the top number on blood pressure reading, the thickened heart muscle can partially regress over time. It is somewhat similar to what happens when you stop going to the gym. Over time, the arm muscles gradually become smaller because they no longer need to handle the extra workload. The heart can undergo a similar process. As the workload decreases by decreasing blood pressure, the muscles may remodel and become close to normal again, improving both its structure and its function. And controlling blood pressure can protect the heart just as it protects the brain. Studies have shown that effective blood pressure control can reduce the risk of developing heart failure by about 50%, which is pretty a significant number. Then there are kidneys. Your kidneys contain millions of tiny filtering units that clean your blood, and they are supplied by an intricate network of tiny blood vessels. When blood pressure remains elevated for years, it gradually damages these small blood vessels, the kidney filtering unit called glomeruli, and the surrounding tissue known as tubulointerstitial tissue. As this damage accumulates, the kidney becomes less and less efficient in filtering waste products and excessive fluid from the blood. Over time, this can lead to chronic kidney disease and progressive loss of kidney function. But sometimes kidney disease is the cause of hypertension rather than a consequence of untreated hypertension. One fascinating example is seen in some people with sub-Saharan African ancestry. They carry certain version of a gene called APOL1 or apolipoprotein L1. These genetic variants are thought to have evolved because they provide protection against a type of parasitic infection known as African sleep sickness. But that protection comes with a trade-off. People who inherited two high-risk APOL1 variants have a much higher chance of developing certain kidney disease. One of those conditions is called nephrosclerosis. Nephro means kidney, sclerosis means hardening or scarring. So nephrosclerosis literally means hardening or scar of the kidney, usually due to damage to the small blood vessels. As kidneys function decline, the kidneys become less able to regulate salt, water, and hormones involving in blood pressure control. And in this way, it drives blood pressure higher. So the relationship between hypertension and kidney disease goes both ways. High blood pressure can damage kidneys, and damaged kidney can make blood pressure even worse, creating a vicious cycle. And that vicious cycle can repeat itself again and again and again. Then there's the aorta. The aorta is the largest artery in the body. It immediately leaves the heart, carrying oxygen-rich blood, and acts like a body's main highway, delivering blood to every major organ through its branches. Because it receives blood directly from the heart with every beat, it experiences enormous pressure. And when blood pressure stays high for many years, that constant force places additional mechanical stress on the walls of the aorta. And if some underlying diseases like syphilis, Marfan syndrome, or other conditions weaken the aortic wall, high blood pressure on top of them can further weaken the vessel's wall, increasing the risk of a life-threatening condition called aortic dissection. An aortic dissection can occur when tears develop in the inner lining of the aortic wall. Blood then enters through the tear and forces its way between the different layers of the aorta, creating a false channel and separate the wall from within. If the dissection extends or the aorta ruptures completely, it can be so deadly without proper emergency treatment. Then there's atherosclerosis. Atherosclerosis is gradual buildup of fatty deposits, cholesterol, inflammatory cells, and other materials inside the walls of arteries. Over time, these deposits, known as plaques, can narrow the arteries and reduce blood flow to the vital organs. And people with high blood pressure often also have atherosclerosis. Hypertension can contribute to the injuries of blood vessels wall and may accelerate the plaque progression. There is no strong evidence that high blood pressure alone directly causes atherosclerosis, but they frequently coexist, and each condition can make the consequence of the other much worse. And most people with hypertension ultimately die from complications related to atherosclerosis. But simply lowering blood pressure may not be enough to eliminate your risk of cardiovascular risks. To further reduce the chance of heart attack, stroke, and other cardiovascular disease, you usually need to tackle multiple risk factors at the same time. That means keeping your cholesterol under control, managing diabetes if you have it, avoiding smoking, maintaining healthy weight, staying physically active, and following heart-healthy diet while keeping your blood pressure in a healthy, normal range. And the good news is that many of these lifestyle changes improve several risk factors at once. A healthy diet and regular exercise, for example, can lower blood pressure, improve cholesterol level, help control blood sugar, and reduce excessive weight simultaneously. And if you want to go deeper into blood pressure, we have a dedicated playlist to blood pressure here. You can check that out whenever you have free time. Thank you. We put a lot of time and effort into scripting, recording, and editing these videos, but our channel is still pretty small. If this type of content helps you even a little, give that like button a gentle hit and subscribe.